that if you work hard, you will become financially successful is a myth. There are millions of Americans who work incredibly hard all of their lives and end up in poverty at the end. My name is Kimberly Graham. I am running for United States Senate. I'm a mom to an amazing son. My dad is one of 15 kids from a family here in central Iowa. My mom was a teenager when she dropped out of high school to have me. I've been standing up and fighting for Iowans in juvenile court for the last 20 years. I believe that we need people in the United States Senate who are one of us. There's a huge influence of corporate money in politics. Once these politicians accept their money and get into office, lobbyists from those industries come knocking on their office doors. They're writing legislation that is going to benefit their bottom line. It's going to put profits over people. One good example is that we have far too high of nitrate levels here in our drinking water. It's even been documented that we have increased rates of thyroid cancer because of that. We still have a system where our schools are funded with this office. What it is like to try to make it financially in 2020 as a working person, to not ever be able to get substantially ahead. Until we get more people like me and you into positions of power, none of this is going to change. We can transform Iowa. Iowa could be a recreational destination in this country. If I don't win, I'm concerned that we won't help small and medium farmers to transition to sustainable and regenerative agriculture. We're never going to see universal childcare, and that childcare will continue to be something that will financially break people. Every Iowan deserves to lead a life of health and dignity. It's time to invest in a United States Senator who wants to invest in you. Vote today. Go to KimberlyForIowa.com. Put people over profits.
Hello, everyone. I'm Kimberly Graham, candidate for United States Senate. We're here today in another one of our online forums. Here we have a very special forum today to talk about one of the issues that is the primary core of our campaign, along with the climate crisis and investments in families and children, and that is the topic of healthcare. And when we talk about transitioning to a universal single-payer healthcare system, a lot of people have a lot of questions, understandably, because most Americans have not lived in a country with any other system other than the one that we have. So today we've assembled a fantastic panel with the excellent help of Vanessa, who's here and has helped put this all together, which I'm so grateful for, and so thankful to all our panelists here. I'm going to just go around and have them each introduce themselves. We have one guest here who is, are you German, Christian?
That's right, yes.
Who's from Germany. And then we have three Americans who either are now or have lived in other nations that do healthcare very differently, or currently live in a nation that does healthcare very differently than we do, or I should say perhaps that does medical insurance very differently than we do. The healthcare itself may not be all that different. It's probably good everywhere, but it's a difference in how we pay for it, and whether or not it bankrupts us, whether or not you die because you put off going to the doctor because you can't afford it. And those kinds of issues. So with that, Christian, go ahead and kick us off.
Yes, so hello everyone. I'm Christian, living in Germany, 45 years old. Actually I lived in a few different countries in Europe, so in France, Italy, Switzerland, and in the UK, studying and then also later working. So I've seen a few European countries and the health systems there. Most of the time I lived in Germany. Yeah.
Excellent. Fantastic. Thanks, Christian. Welcome. And Vanessa, go ahead and tell us a little bit about yourself.
So I grew up in Cedar Falls, Iowa, so I consider myself an Iowan. And then I went to college in Southern California and worked for a year in the U.S. And then at the age of, I guess I was maybe 23, I took my first job in France, moved to France, lived there for 3 years. And then in 2006, moved to the UK for for a job and was in the UK for 12 years. And now I have fallen in love with a man who lives in Iowa. So am thinking about moving to Iowa this year. And one of the reasons why I was interested in organizing this forum is because I have to admit, I'm really afraid to re-enter into the US system. I'm self-employed, and perhaps that's one of the reasons why. Perhaps if you already have an employment, then it's different. But anyway, so I've just had really great experiences in France and the UK. And so I thought one way to give of myself and my experience is to just share with Iowans and Americans those experiences to perhaps help dispel some myths that are floating around.
Right. Yeah. And, unfortunately, we're seeing with the COVID-19 crisis that it's a big, big mistake to have your healthcare tied to your job. I mean, and for anybody watching who's American, that not all jobs provide healthcare anyway. So and that is one of the major factors for most people when they're looking for employment. One of the first things they want to know is, does it come with any kind of health insurance? And even if it does, it's probably, in most cases, doesn't pay 100% of it. You still have to pay quite a bit out of your own pocket, and then the employer pays part of it as well, as the most typical scenario. There's some rare jobs that will pay 100% of your insurance for you, but those are very rare. And then in our gig economy, it's highly unlikely your job is going to pay any of your medical insurance at all. So then you're on your own. And if you're self-employed in the United States, own your own business, you're totally on your own. You get to try to figure it out and pay thousands and thousands of dollars a month for probably not a very good policy. So let's go ahead. Sarah, do you want to go ahead and introduce yourself? And for anyone who's actually not speaking, when you're not speaking, if you could put mute, if you could hit your mute so that we don't hear background noise. I'm getting background noise from somebody. I don't know. Sarah, go ahead.
Great, thanks. Hi, I'm Sarah. I live in Calgary, Canada, up in Alberta. I've been here for just a little over 10 years, and I have 2 kids that were born here in this healthcare system. I was born and raised in the U.S. in California, and similar to Vanessa, left a little bit after school. And worked actually in France and Switzerland for a while, so had a little experience there. But most of my kind of experience in the healthcare system outside of the U.S. has been in Canada, and had a lot of it with the whole going through having kids and then having all the things that happen when you have kids and deal with their issues. And so when Vanessa asked me if I'd like to join, I was excited about it because I think one of the things that is just reflecting back on what it's like to be someone who was in the American system and then now has been in the others. It's just sort of, I almost feel like people are just sometimes not even aware of how much simpler it can be, right? I hear these stories from friends that have had, kids in the US, and just, even if you are lucky and you have insurance, all of the paperwork that comes along with having a kid. And, I went into the hospital and walked out with my 2 children and that was it. And then, I never thought for a moment about anything to do with payment around that. So yeah, really happy to kind of share the experience and the good and bad about the kind of healthcare systems I've seen.
Awesome. And, since the Canadian model is really the one that most closely resembles the one that we want to head toward, at least the majority of people who want to make that change, that's the model we want to head toward. We'll probably have extra bonus questions for you, because we all know that no one can get treatment there and it takes 5 years to see a doctor. And then even when you do, who knows? Yeah, it's just, all that. So I'm sure we'll have a lot of, P.S. by the way, my partner of 13 years is Canadian, so I already have my own cheat sheet, bird's eye view into what that's really like. But anyway, what's Tim saying? I'm getting a message. Oh yeah, I got it. Thank you, Tim. We asked people if they had questions for all of you on Facebook, and we have about 50 questions so far. So we better get going. Okay, Natalie, go ahead and introduce yourself.
Great, that's fantastic. There are already so many questions. So my name is Natalie. I'm actually from Iowa as well. I was born and raised in Iowa. I lived and worked after college in the United States for 5 years, and I've been residing and working in France for the last 15 years. So I think one thing that's quite interesting is the time that I was living and working in the United States, healthcare was always something that was really on my mind. It was a worry. how I was going to get healthcare, how it was going to be paid for, etc. And I must say that the time that I've lived in Europe, I don't even think about it. And that's something that's quite positive. And that is simply because I have easy access, so it's accessible and it's not too costly, and the care is good. So I'm happy to kind of do a comparison of the systems in the sense that I have both lived and worked in the United States and in France.
Yeah, thank you. Yeah, one of the things I talk about when I talk about healthcare with voters is that I don't think we talk enough about the emotional cost and the mental cost of worrying constantly about either your own healthcare or the healthcare for your children, your family. The United States is consistently rated as one of the least happy nations of all developed nations in the world. We rank toward the bottom. And I really believe that this fundamental, constant, low-level worry that all Americans carry around with them about our healthcare, like, can we afford it? What if we get really sick? Even if we have insurance, we have this giant bill, this deductible, or this copay, or this part that insurance didn't cover to try to take care of. It literally weighs on all of us, and we're so used to it that I don't think we talk about it, and we're not even aware of it because it's just something all Americans live with. But it's horrible. And I also talk about the toll it takes on workers in the medical insurance industry. I cannot imagine sitting in my cubicle at Blue Cross Blue Shield all day long and having people crying and yelling and screaming at me because Blue Cross denied their loved one's claim and won't pay their prescription or won't pay for the surgery or the whatever it is that their family member or they need to, in some cases, to live. And the whole model is to deny claims. You charge premiums, and the more claims you deny, then the more profit you make. So some insurance companies in the U.S. are nonprofits, but even saying it's a nonprofit, they can still set CEO salaries and so forth quite high. So anyway, I just think that emotional and mental cost, the physical cost, the fact that the United States has now fallen behind Canada in the last couple of years for the first time in life expectancy, in spite of the best research hospitals, probably arguably in the world, and some of the best medical facilities in the world are in the United States, but only if you can pay for them. And so now our life expectancy has been falling now for a few years. So let me pull up the questions.
Hey, Kimberly, can I just speak quickly to what you said about anxiety?
Yeah.
I was just going to say that a couple of people, I guess, have said that, yeah, there's an anxiety that's not spoken about because we're just used to it. And that really speaks to my experience, and my experiences, like what Natalie said. So I think what's ironic is that I'm completely healthy. Why would I worry about healthcare? And I never have. And so it's fascinating what I see, and why this has started to come onto my radar is the prospect of moving to the United States is creating this anxiety for me that I've actually, at the moment, I'm on a travel medical insurance because I'm still technically a resident of the UK. And I've noticed that at night, sometimes I'll stay up wondering even if something bad were to happen to me, would my travel medical insurance cover me in this country? And so anyway, I think I'm guessing what happens to Americans, like if I were to move here, then that anxiety level would just become, that low level anxiety would just become normal. And again, what's fascinating, I'm completely healthy. I don't have anything wrong with me.
Yep, absolutely. I mean, it even if you're feeling perfectly healthy, you sort of live with this feeling of, well, but I may not be all the time, and then what's going to happen? Like, it's just this ridiculous level of fear that we deal with. So we're just going to kind of just march through these questions. Sue asks, I'm curious about whether there are different levels of healthcare, even unofficially. In other words, are the very rich going outside the system to receive treatments and procedures? Somebody answered her, actually, who says she's from Germany. And this person said, Christian may have a different take on this, but this person said, we have government-regulated private health insurance government regulated public health insurance and private health insurance, or you can have a combination of both. Well, that just sounds wasteful in my opinion, but okay. My dad opened his business and then had private insurance. There were some perks, but nothing that stood out dramatically over my mom's regular public health insurance. I think that overall people are satisfied with their care, so there isn't tremendous envy or demand toward the private insurance. That's what this other person said. So what do you think, Christian?
So from my experience, so how does it work in Germany? There is indeed the public health insurance system that's basically run and organized. It's a scheme organized by the state, if you want, and the vast majority of people are part of that system. So it's possible under certain restrictive conditions to opt out of that, but I think 90% of the population are part of that state-run system. That's why also I think it works, because it has a relatively broad base of people of different health statuses and different income levels. So in that sense, it's that's I think working okay. The way it's financed, basically you have to pay a certain contribution based on your salary. So if you earn more, you pay more. If you earn less, or if you're even unemployed or living on benefits, then you don't pay anything at all. But the level of benefits that you get doesn't depend on how much you pay. So everyone gets the same level of benefits. And then, of course, you can take additional private insurance to top things up. So, for example, we have basic dental care as well included in the public health system. But if you want to have a complete refurbishment of your teeth, that might be very expensive. So then people either pay that out of their own pocket or have to have some additional insurance. But overall, I think since it's many people who are part of that system, it sort of balances and works okay, and has a really, I think, good level of healthcare. So it's not just emergency healthcare; it's really a good basic level. So I would say you do not really need additional protection. If you have that, you're already fine, and you don't need, I think, to worry about will I be able to stay alive and afford it.
Yeah, my understanding, and I could be mistaken, but my understanding is that even the private insurance companies, though, in Germany are nonprofit. They are not allowed to be for-profit, and they're pretty tightly regulated, and there's a lot of oversight.
I think there's still for-profit, but it's true there's quite a lot of regulation around that, and also, therefore, I think also I think this was also the comment on that you just quoted. I think it's not hugely different what you get as benefits, whether you're in the private or the public system.
If I could just add something, I think that the French system is quite similar to the German system. I mean, the premise is that there's universal coverage for everyone, right? If we go kind of the basics of what the system is about, that there's universal coverage, that means that it's accessible to any resident of France, regardless of your age, regardless of your income, regardless of your status. And the way that it's broken down in France is that overall health costs, you're looking at about 80% of those costs being paid by the state-run healthcare system. 13% by private insurance companies. So that's when people, like Christian mentioned, decide to top up, take additional insurance out to kind of compensate for something that's not entirely covered. And then only 7% is paid by individuals overall, which I think France is maybe the lowest. When you're talking about actually paying out of pocket, it's the country of all the countries in the OECD that pay the lowest amount in that regard. But the idea is, I mean, in France, there's kind of two tiers. You have, and I can even just give you some figures so people get a sense. If you want to go see a general practitioner, for example, there's what we call Sector 1 and Sector 2. Sector 1, you go to a general practitioner, it costs 25 euros. That is paid for 70% is paid by the state-run system. And so then you're looking at having, maybe 8 euros out of pocket to pay. And if you have additional insurance, then it would compensate for that difference. And then there's kind of a Sector 2 where some doctors choose to have their own prices that fix their own fees that might be a little bit higher, but they're never entirely, unreasonable. And that, for example, you could elect to see that person as well. And then if you had the private insurance, that would cover the difference as well. So you have some different options. But overall, most of the healthcare costs in France are being paid by the state system.
And it works a little bit differently for us in Canada. So there are, and I should say I'm speaking about Alberta, each province and each state is a little bit different too. But here there's pretty strict rules about what you are allowed to pay for outside of the public system. And so, sort of all basic medical care, going to see a family doctor, the majority of things you would even have in the hospital, you're not allowed to kind of pay outside of the public system for that. And I think that that's actually part of what works well in keeping the public care quite good is that, the wealthy people, yes, sometimes for certain things, like if you're talking about, a hip replacement or something that's non-urgent where there might be a slightly longer waiting time, somebody might find a way to go outside the system by going somewhere else. But for all of those kind of like basic and then also, very important kind of life-saving type medical treatment, that's all covered 100% by the state and there isn't another option. We do have private insurance that sort of tops up, and what it will do is cover things that are not included in that basic care. And there's an ongoing debate around that. So like for now, the dental is not included in our basic healthcare system. There's a lot of people that think it should be added. And I think that, Canada is sort of wrestling with that, similar around some of the drugs. But that all of that kind of basic life-saving care, you would always be covered under there. And then also, I remember when I was in Switzerland, there, like the difference between the private and public and top-up insurance, it was usually around sort of like, you'd almost call them perks, right? So like the private hospital might have like, a single room after you give birth, something like that, or like a fancier meal or things like that. But that when you got to the level of really, serious, detailed medical procedures, even the private system would, contact the public doctors because that's kind of where the like best care was.
Yeah, that's interesting about Canada and the dental, because dental actually is a major health issue and it can result in you having a heart attack or a stroke if your teeth are not well cared for. So that's very, very much a serious medical issue. I'm kind of shocked by that, actually.
Yeah, I think it's a little bit about the time of like when it was set up. And it is, I think, fair to say that it's a live debate now, right? And people are saying this is something we should change.
Another issue that we have here, the proposed Medicare for All bill in the United States includes dental, it includes vision, includes glasses, it includes hearing aids, which is a huge, huge expense for people that is not usually covered. And it includes any mental health care, including therapy and all of that. It also includes all nursing home care. So it's kind of like go big or go home. So, we're the wealthiest nation. We can afford it. And we should. Let's see. We have, what's the average wait time for specialists when it's not emergent? And I totally understand for anyone hearing this after the fact, what's emergent might be different from whichever side you're on. Like a medical professional may not consider your need urgent, but you may. I get that. Somebody said they had to wait 10 months to get a neurology PA. I don't know what they mean by that. Physician's assistant? I don't know. It's been 8 years. She still hasn't been able to get to the top of the list for a female neurologist locally. I don't know. People, I don't know exactly what they're getting at. This is all they say. People here claim it's so much longer when in reality it's comparable or less than. Oh, I think I see what she's saying. So a common refrain with people that don't or think they don't want or have trepidation about a Medicare for All system is that they believe because their second cousin's aunt lives in Canada and had to wait a year for a hip replacement that everyone dies waiting for their medical care in Canada or something, like that. In reality, I'm an attorney for abused kids and for parents in juvenile court, so I know a lot about people trying to get appointments with like a psychiatrist and different medical professionals and how long that can take here in the central Iowa area because of our lack of the number of medical professionals that we need here. And that's not maybe as much the case in huge metropolitan areas where they attract a lot of medical professionals who want to live there, and so they don't have as much of an issue. But in rural areas especially, it can be months and months and months and months to get into certain specialists, especially psychiatric care here in Iowa. So what are all your experiences with like seeing a specialist where you live, if you have, or if you know anyone who has? Yeah.
So we had a couple of minor things with my kids that thankfully have all turned out to be fine. But in every case, we went to our family doctors. So you don't have that's sort of the setup here. You have a family doctor as opposed to a pediatrician. And she gave us referrals to see kind of like a pediatric specialist, and one was neurology. And it was within like the month or so we got a call, and then we had an appointment in the next month. And it was, not at all life-threatening, but I thought quite fast. The ones that I have heard of are they tend to be things like the hip and knee replacements where, there's a certain budget that's put towards those by the government in a given year. So, I think one thing that's also true is that, wait times and how much access there is, it all depends on how much money you invest into the system, right? So, as long as you're investing into the healthcare system, then that's going to be available there. My own personal experience is that whenever there was an issue, I was pregnant with twins. And so that kind of automatically bumps you into this higher risk class. And I was in with the maternal fetal specialist, within a couple of weeks of getting the diagnosis there as well too. So I've never had a time where there was anything even, slightly worrying and I wasn't able to access a specialist quite quickly.
And I think that the idea of people going kind of around the system and going to like another country or whatever to get like a knee replacement or hip replacement, that happens all of the time in the United States because of the cost, not necessarily because of the wait times, but people that can afford it will fly to Belgium is a common popular one because they tend to have decent healthcare. They'll fly to Belgium. They'll stay in a fancy hotel. They'll go into the hospital, get their knee replaced, go back to their fancy hotel, stay there for a month recovering, and fly back to the U.S., all for less than it would have cost them to do that same procedure. All of that, plane ticket, hotel, all of it, for less than it would have cost to do that same surgery in the United States. So that's kind of, what's one of the problems that we're having here is the cost of it, and depending on what kind of insurance you have or don't have, or, all of that.
I can just say something quickly about, I was trying to think, I don't even know if I've needed to see a specialist in the UK, but in the UK, my understanding is you go first to your GP and then you're passed on to a specialist. But I remember speaking to Christian that I think in Germany you can go directly to specialists. And my experience, and I love, there's so many things I love about the French system. I suppose I love the UK and French system equally, but I think in France as well, you just kind of call up a specialist, Natalie, and show up.
Well, there are certain specialties, for example, gynecology, ophthalmology, psychiatry, where you can go directly to a specialist without going through your general practitioner first. For other specializations, if you want to benefit from the best prices, you should go get a referral from your general practitioner. But as to the question as to wait times, I know that is kind of often used as a reason why people think that we shouldn't have universal health care. I've never had even the slightest wait. Now, I should preface that by saying that I do reside in Paris, so I live in a big metropolitan area, and I think that some of these issues are not unique to a country, but more of a question of metropolitan versus rural areas where there are the most doctors and the most specialists. So I don't necessarily know that it's per se a link to universal healthcare. I've never had to wait in the slightest to get in to see any specialists, and I've seen some very good specialists.
Somebody else asked, what would you like to see different in your system? Somebody says, I'm familiar with the UK system, but with other systems, how hard is it to get in to see a doctor? I think we already covered that. What about specialists? We just covered that. Do they feel that any equipment is outdated? I don't know if you guys know enough about equipment to know if your equipment was outdated, but but anyway.
Hey, Kimberly, what I find interesting about this question is my perception of the United States healthcare system is that there are all these barriers to even get access to healthcare. I had an infection in my pinky. I went in to see someone, cost me $100 to get through the door. And the woman couldn't give me, she said it'll be more than $100, but I can't tell you how much it will actually be until after the procedure. So I refused treatment. So what's interesting in that question is, like in the UK, we don't even have, there's not any even money exchanged ever. And you just walk in and you just get services. And so what's so fascinating to me about that question is, why would Americans be, I mean, I'm not trying to be, but genuinely, Americans are asking other countries, like, how hard is it to see a doctor? It seems like a backwards question to me.
Well, I think that a lot of times, not always, and I don't know, I don't know this person, like I don't know this person personally who's asking this question, so I can't speak to their exact financial situation. But I think that a lot of times, what I find anyway, personally, just on an anecdotal level, is the people that want to know things like that are the people that are middle to upper middle income, have plenty of money to go in and see a doctor pretty much whenever they want here in the US, have good insurance, or at least they think it's good until they get really, really, really sick. And then they start finding out about all the claims that are going to get denied and all the appeals they're going to have to go through and all of that, which is something I hear from cancer patients in the United States constantly about the fact that they're always fighting with their insurance company while they're trying to get well. And so I think that it comes from sometimes a perspective of they think the American system is just great because it's just great for them because they haven't personally had any problems. And they may have a job where maybe their employer pays 100% of their premium. And so they personally haven't experienced the struggle that the vast majority of Americans do. And so that's why they're asking that question. They're like, hey, I think it's great here. But I hear this and that about Canada and about this country and that country, and I don't want that. I don't want to wait. So that's where they're coming from, I think anyway.
Just because you were asking about what could be different, and it kind of links back to what you were saying before. So as I mentioned, we don't have dental coverage, and the prescription coverage also is a little bit different. And then the long-term care homes are also not, I don't know all the details because I haven't had to kind of deal with that part, but they're not completely within the system in the same way or not like funded in the same way. And so I would love to see all those things be put into our public healthcare system because I think you see the difference, right? Like, I don't know if people have been following the news about Canada, but with COVID-19, things are pretty well under control. One of the biggest problems that we've seen is actually with the long-term care homes, like the one part of the system that's not within the public system. And so, and that's also really started that discussion up again where people are saying, hey, actually, maybe we need to change this to be working better. Because I'll say, like, also, I was fortunate growing up in the U.S. to be the child of parents who had that, good healthcare. And I remember having to wait to have knee surgery because we had to wait to get the approvals from the insurance company too. So, yeah, I think there is a lot of like that fear of the unknown or the fear of what you hear. And that, when you kind of live through it and you see a system that is funded and, is run well, a lot of that you realize there's no reason that the single, public healthcare funded system can't be just as fast or faster than the other, right? It's about, the decision makers are the government instead of the companies that are trying to make money from the from the insurance. So it's not fundamentally, undoable. And,
and that's another concern that I hear sometimes is, well, I don't want the government deciding if I can or cannot have this drug or can or cannot have this procedure. Well, I think when you have a publicly funded system, you have the opportunity to create, well, I guess I should ask you guys, I mean, is that even, from your understanding anyway, as a consumer of that service, is that even a thing? Like, is that a thing where your doctor says, Mary Smith needs X and the government or, which is the insurer is saying, well, no, we're not going to pay for that.
I think the systems that we discussed, like in the UK, for example, in France and Canada, they're all a little bit different in Germany again. So it's really like, especially I know the UK a little bit because I lived there as well. There it's really a full state-run system where even the doctors are employed basically by the National Health Service. That's totally different again in Germany, where it's run via an insurance scheme. Public and private, to a large extent public, as I said. But I think what is common in all these systems is that there's, I think, access for everyone to the system. So no one is basically, because he cannot maybe afford it, or so that he will not have health, he or she will not have health insurance. That usually should not happen or cannot happen. I think that's probably the common theme, given that there are lots of variations and probably lots of positives and negatives of the different systems, and also in Germany there's lots of debate all the time. Is it too costly? Is it efficient? So here we can also see specialists, for example, come sometimes with a longer waiting time, but then some people say, okay, this creates extra cost. If it's more efficient if they would go through a general practitioner first. So there's always pros and cons, but I think the common theme that I see is that everyone can access the system. There's no one left out. And I think this is probably only possible if there's at least some backing by the state to some extent to ensure that.
Yeah. Anybody have experience with like a doctor saying so-and-so needs this, and the government, I guess, who's the insurer, is saying, no, we're not going to pay for that?
I guess one of the things that I was going to say, and this is to me embodied by, I'm in Dubuque, Iowa at the moment. And I was talking to a man here just kind of casually, and healthcare came up, and I was explaining to him how the UK system works. And the first thing he said is, well, how do they make money? And I was like, well, that's not the...
that's the whole point. You don't make profits on the backs of sick people.
But here's the thing. The reason I bring this little micro story up is because I think in the UK and in Europe, there is, and I liked when you brought up in your debate on Monday, Kimberly, you said that these are capitalist countries. I think there's an understanding of what you put in the free market and what you let the market control, and what really has no business being in the private sector. And so there's just, I think in my experience, on that side of the pond, it's just given that you're not, I mean, you don't put something like, you don't subject that kind of service to market forces, because we can't mess around with people's well-being and health. And so, and then you can have your capitalist economy for everything that makes sense to have in the free market. But so I think, I think the mentality is different.
Yeah, if I could just piggyback off you, Vanessa, I do think that this system is just purely a reflection of a mentality or set of values, which is that everybody deserves to have a level of care that allows them to live with dignity. And your income shouldn't be the determining factor of the type of care that you receive. And it's just kind of simple as that. And everybody, for lack of a better term, buys into that concept. Here, I have never in my 15 years run across someone in France who doesn't think that the healthcare system should be universal. You can have debates, as Christian mentioned, around how it could be more efficient or different ways of running it. But the concept on which it's based, which is that everybody should have access just so that we can all live with dignity, I've never heard anybody call into question along all of the political spectrums here in France.
Yeah, I've even noticed that, I mean, there's always going to be way out there people, so I get there's always going to be those few crazy exceptions. But even the most conservative Canadians, like conservative politically and in so many other ways, do not want to get rid of their healthcare system, and especially business owners, because the United States, we are losing businesses to Canada. They're peeking over the northern border going, let's just move over there where we won't have to deal, just across that little line, where we won't have to deal with how are we going to pay for our employees' healthcare. And how are we going to pay for our own healthcare as a business owner? And how are we going to, so businesses that are able to have, we're losing businesses to Canada that are relocating there because of that. And that's something that, every single American business owner should be in favor of a universal single payer healthcare system, because it would increase their own personal bottom line, if for no other reason, because they would no longer have to use any of their own profits from their corporation or their company to pay for medical insurance. So anyway, any issues with that in Canada, Sarah, as far as something not being paid for? I mean, I realize it would be wait, but
I was trying to think of what it could be. I mean, certainly not, I've never had a time where I've had a doctor, who said, oh, you should have this. And then I couldn't somehow, as I mentioned, I mean, most of my interaction with the healthcare system has been around, having been pregnant with twins. And obviously that came with a lot of ultrasounds and monitoring and conversations and visits with doctors. My kids have had the run of mill, things that you end up in the emergency room for when you're a kid. And those have always been, x-rays or whatever it is stitches has always been just taken care of. The only time I've ever heard about sort of things not being approved would be like some kind of really experimental type treatment, or some of the like maybe very extreme cases like that. Again, there's things around the edges. So the question of like how far you're and what gets included under universal healthcare, I think is really important to get right. Yeah. And those things aren't covered here either. I mean, those experimental things are not going to be covered by Blue Cross Blue Shield or Athena or Principal or whoever you've got your insurance. One of our 970 something companies that do insurance in the U.S. They're not going to be covered by that either. I mean, that's a big. Yeah. That's the same. So it doesn't sound like, it sounds to me like in those other, in other nations, other developed nations, if your doctor says they feel you should have X, then you get X. It's not a matter of a pushback like it is here with insurance companies. No, there's no one to push back, right? It's just you sign it and you get it. The biggest debate actually we have around is that the parking at the hospital you have to pay for. And that often comes up as people's concern about paying. If only parking at the medical facility were an American's biggest problem, we'd be like, yes, we'll pay for parking. Sign us up.
Hey, Kimberly, I think on one of your other forms, you shared at one point what your premium and your deductible is. Do you feel comfortable sharing that just to like shock Europeans? Well, mine now, thank God, I live with my fiance now, so we're allowed to declare ourselves domestic partners, which means I can be on his medical insurance. So now my insurance currently is nominal. I mean, he's one of those lucky people. He's a software engineer. He works for a bigger company that pays most of his premium. So I think it's a couple $100 a month. So we are one of those very, very lucky people. Very lucky people. However, we're both pretty healthy and we don't really use the care that much. So, but when I was paying my own up till a couple of years ago, it was, so my house payment, including my taxes, was about $850 a month. And my medical insurance premium a couple of years ago was about the same. It was like $775 a month just for me. My son is on his dad's insurance. That was just for me. And then I had a $1,500 per year deductible on top of that I had to pay for before it would start paying for most things. And then I had to pay $25 or $50, depending on the type of doctor, every time I went to the doctor as a copay. So I think this $9,000, $10,000 a year just for the premiums, plus another couple thousand potentially in deductibles. So $10,000, $12,000 a year for one person. And so this is, I think, what's kind of, as I've been just chatting to people, this is one of the reasons I'm like scared to move to America is, as a self-employed person, is, I'm hearing these stories of these crazy deductibles. And so what I understand is that, I had this like melasma on my forehead, which isn't going to kill me. But in the UK, I go and I check it out. This story with this infected finger, it's not going to kill me, but I'm not going to, if I have a $1,500 deductible and it can't even be given a price before I say yes or no, I mean, I just,
Yeah, I mean,
it's
something like that would be like a copay, typically, at least for most insurance. So you could go see a doctor for like $25-$50, something like that. But then, that's another issue that we have here that shocks a lot of people in other developed nations is if they say, okay, we need to do a little minor surgery on your finger to look into what's going on in there or something. And then you say, okay, well, how much is that going to cost me? Because you need to know, right? Because you know you're going to have to pay some of it. The doctor's office can't tell you. And if you call it, they'll say, call your insurance company. And when you call your insurance company, they will literally tell you they can't tell you, call your doctor's office. And so what other industry do you know that will not give you a price until after you have the service done? And you literally cannot find out. You cannot. No one will tell you. And then you just get a surprise bill in the mail and then see if you can pay it. So it's literally ridiculous. It is absolutely ridiculous. Somebody asked, do all of you, believe that Americans have a better or worse quality of life? We already covered this. Due to our for-profit health insurance. In the words of my Scottish friend, American women, I would say men too, have a palpable amount of fear of becoming ill. It is not like that for people in my country. I know the answer. That's why I voted for Bernie at the caucus and you today by mail. Anyway, so I just saw this. It's here somewhere. I actually printed it out because it was so stunning to me. Oh, here it is. It's right here. In the Guardian newspaper. A week and a half or two ago, there was this article that had a lot of information and was written from the perspective of an emergency room doctor in New York City. And then they gave the journalist gave a bunch of additional statistics. And they said that more Americans are afraid of paying for healthcare if they become seriously ill than are afraid of getting seriously ill, according to a 2018 poll by the University of Chicago. 40% of Americans are afraid of the bill if they become seriously ill. Only 33% are afraid of getting seriously ill. So yeah, we all literally, anybody who thinks about it lives in fear of the bill from getting seriously ill. And one of the most kind of poignant things they talk about here in the second paragraph of this article is they say with over 30,000 people, and this was in mid-April, that number is no longer true. With over 30,000 people dead in the United States and more than 639,000 infected with COVID-19, the last question on a person's mind should be how they would pay for life-saving treatment. But as the death toll mounts, a patient who was about to be put on a ventilator in one of New York City's stretched to capacity ICUs had a final question for his nurse. Who's going to pay for it? Before they intubated him, and he ended up passing away. The last thing he ever said on this earth as an American was who's going to pay for it. And I know for a fact that those are the last words out of a lot of Americans' mouths in emergency rooms all over this country, that people are scared to death of leaving their family. If they should end up dying from whatever their medical emergency is, they're scared to death of leaving their family with all of this medical debt. And I know stories like that are true, and I don't understand. I don't understand I understand change is hard, and nobody likes change, and humans don't like change, and it's scary. But hearing these stories, and if anyone takes the time to look into other healthcare systems seriously, not just listen to GOP, Republican Party talking points, but actually look into other healthcare systems, I don't know why anybody would make a different choice than going to a universal single-payer healthcare system.
Yeah, I just kind of around the subject of fear, I thought about the other night, I'm a new mother, so my daughter is 10 months old. And she had a very high fever. And so it was this question, do I take her to the emergency room? Don't I take her to the emergency room? And I had a high level of stress, but the question entirely was turning around. Do we get in the car and go in the middle of the night? That's kind of annoying. At no point does money even remotely enter your thought process.
And that is the very first thought of most Americans in regards to their health. That is the very first thought.
and I did think about the American system, and I did think to myself, thank God I'm here in this system where that doesn't have to cross my mind. No, I know if you're covered well in the United States, that doesn't necessarily cross your mind. But if you aren't covered well, that is a huge decision that you're having to make for somebody who is dependent on you. And there are things to weigh that you shouldn't have to weigh. And I just kind of a quick perk to the French system as well. There are house calls as well that are covered by the system. So you can call a doctor in the middle of the night who will come to your house. If it's during the day, I think it's around 45 euros or something like that. And again, it's covered. 70% of that is covered by the state. And if it's in the middle of the night, I think it's something around 70 euros. Again, 70% would be covered. Or the base level of reimbursement would be covered by the state. So those are things too. I mean, I've had I think I've done that twice in my 15 years I've been here, where I was literally writhing on the ground from a flu or something, where I called the doctor and the doctor comes and gives you the medicine that you need, and you don't even leave.
That's fantastic.
To your own home.
What you're saying reminds me of something else I read recently in regards to the COVID-19 epidemic or pandemic, and that is that I can't remember which country it is. It may be Germany, Christian. I can't remember the country, but I think it was a Western European country. That their death rate is so much lower, at least so far, and they have nurses who go to the COVID-19 patient's home. I think it's daily, and monitors their pulse ox to make sure their oxygen level, because one of the tricky things about COVID-19 is it decreases your oxygen saturation level so slowly that you might not even really notice it, and then all of a sudden you're in severe respiratory distress. And so by sending nurses to COVID patients' homes daily and making sure they're monitoring that, they can get the people into the emergency room or the hospital sooner, before that patient even realizes they're in as much distress, in regards to their oxygen levels. And so, yeah, I mean, when you do things like that, you can literally save people's lives by having more access to care. And the public health system in this country, that is the system that deals with infectious diseases and so forth, that's a whole other show, as they say, and we're not spending nearly what we need to spend in the United States on our whole public health system in regards to infectious diseases and all that. People who are against universal health care say those who have it die because they cannot get in. Do they really? I'm laughing because it's like the opposite. Do they really have waiting lists, or is this just another lie? I think we kind of pretty much covered this already. It's kind of the opposite. I mean, I think that unless you are middle or upper middle income and have a lot of disposable cash on hand so that you can pay a deductible or a copay and not blink about it, and you already have really good, for American standards, good health insurance, it's the opposite. The last studies I've been able to read, they vary widely, but from 30,000 to 45,000 Americans die every year as a result of not seeking care because of fear of the cost, or putting off care, or waiting and waiting and waiting, not check out that lump because, it's probably okay. And then you don't go get it checked out because it costs so much anyway. And then all of a sudden your cancer is advanced and now you die where maybe you wouldn't have had it been treated earlier. So it's hard to ever put a firm number on how many Americans die because of our medical insurance system, because there's so many factors going into all of that, but a lot. So I think it's the opposite. I think there's more people dying here from our system than in other countries. Yeah, Sarah?
Yeah, I was just going to say, I remember actually there was one weekend where, I don't know, my family's accident prone or something, but my dad in the US and I both had to go to the emergency room for different reasons. And we were we must have been texting or something while we were like going through. And it was striking how the process was so similar, right? Like we both went to the emergency room, we checked in, and it was, in either case, it was life-threatening. So we were both waiting around a little while, and then we got seen and taken care of. And then the only difference was, he paid a copay and then got a bill, or got the bill later, and like I got nothing afterwards. So I mean, it just, yeah, your comment about the other thing too reminded me that I had actually even been referred once to have a biopsy for something that turned out to be totally fine, but yeah, again, just got straight in quickly, and so the idea that there's these long waiting lists and that people are dying on the waiting list. I think that there's some small shred of truth in some of those other types of procedures, like the things like the hip replacements, where the public system has decided, well, this is just how much money we want to put towards this. I think that people either hear that or misunderstand that and think that means that applies to all kinds of medical care, and it's just that's just simply not the experience that I've had, or any of the people that I know here.
Yeah, and I mean, and I know so many people, including myself, who have put off going to the doctor because not only the copay, which may only be $25 or $50, which for me, I can handle that. But then I know I have, even on the insurance I have now with my fiance, we have a $1,500, I think it's $1,500 deductible. And even something like an X-ray or an ultrasound is subject to that deductible. So I can go to the doctor for $25 maybe, but if they say, oh, you need an ultrasound to check that out or an X-ray, then I'm going to have to pay $300, $400, $500 or whatever the actual cost that I'm going to be billed for that X-ray. So even something as basic as an X-ray is usually subject to that deductible. So if you have and we have a pretty low one, honestly, $1,500 deductible nowadays in the U.S. is pretty low. Most plans have $5,000, $10,000 deductibles. So you're paying all of that stuff. Yeah, you can go to the doctor, but then if you really need any tests or any actual treatment or dig a little deeper, that's probably going to be out of pocket up to a huge amount.
This reminds me too of just the issue of travel insurance. So I think so I'm guessing Natalie and Sarah, like me, when I travel to the United States, despite the fact that this is where I was born, I have an American passport, I have to purchase travel insurance. And so I think, again, from the European standpoint, from the British standpoint, the idea is that you have your home country, and in your home country, you're fine. And if you travel, you then need to purchase travel insurance, which would cover if anything bad happens to you medically. And so I think, always, there have been times when I've traveled to the U.S., and, I've realized, oh God, I don't have any travel insurance. And so then I'm scrambling around, making sure I am covered with travel insurance in my own country. It also brings the question for me, brings up the question for me. So I am now a dual citizen. So I have a British passport and an American passport. And there are some countries, I think India is one, Denmark, I think, is another, that only allow you to have one passport. And I've always kind of thought, I'm glad I don't have to choose, but if I did have to choose, I'm from America, so my inclination would be to keep the passport where I grew up in America. I'm first American, but I've come to realize with the healthcare, I mean, if I did have to choose, I don't know, I don't know if I don't know what I would do. I might have, it wouldn't, be crazy if I chose the British one just because of the healthcare. And so I think, again, just thinking about how we're looking at healthcare, like a difference in mentality, that whole needing to buy, like, for example, Christian, the idea of you needing to buy travel insurance to travel to Germany when you're living in the UK, for example, I'm guessing that probably seems pretty strange for you.
Can I say something? I'm sorry, Christian, go ahead.
No, go ahead.
No, I was just going to say the irony is when I travel to the United States, I've gone to the doctor before in the United States, and it's the French system that reimburses me for my American healthcare costs.
That's nice.
So I just have to keep the receipt. I bring it back to France, and they reimburse me for the costs. And I think that's crazy. I'm a French citizen as well. I'm both American citizen and French citizen. But like you, Vanessa, I was born and raised in the United States, and I just think that's ironic that it's the French government that is paying for my healthcare costs when I go to the United States.
And I just have one other anecdote, and then that I think is interesting. So I'm in August of 2018, I became a digital nomad, so just traveling in perpetuity. So I did this whole research project around, gosh, what do digital nomads do for health insurance? And so I did this big research project, and what I found, I maybe looked at 3 or 4 different insurance companies. This is quite a niche thing to be a digital nomad, and they basically were forced to have 2 different policies. So covers the whole world minus the United States, and covers the whole world plus the United States. And the one that I ended up going with, I obviously had to do the one with the United States because I'm here a lot, was twice as much as the other one. And so I think that just now, how do we fix it? I don't think anyone can deny that is a problem. How do we fix it? I don't know. But I think that, again, just these kind of little anecdotes is fascinating, if nothing else.
Right. So we're on like question 6 out of like 48. So obviously we're not going to get to all these questions. So I'm going to try to like rapid fire these. Some of these are pretty easy, like, yes or no kind of almost. Is the insurance truly universal where you live? I think we covered that. I think the answer was yes. Like there is no one who, doesn't matter what your income is, you're covered. Who is not covered? No one. Everyone's covered. What is the catch? There is no catch. Are they paid? Yes.
Just quickly, I think an American might consider a catch that, generally speaking, I don't know about Canada, but generally speaking, in the UK and in Europe, we do pay higher taxes.
Of course.
I mean, is that...
We're going to get to that. We're going to get to that.
Okay.
Are they paid for by one or more regressive or progressive taxes? For example, Canada pays for it with a regressive sales tax. I'm not sure that's accurate.
No, that's not true. There's so the sales tax has like a rebate for low income consumers. I actually don't know how that works in the U.S. if that exists, but there is a sales tax, and in our healthcare, it's not sort of like 1-to-1. Obviously,
like a value-added tax.
Yeah. I mean, similar to how you have sales tax in the U.S.
Mm-hmm.
But then if you are below a certain income, then you get a rebate, so you get that tax back. And so that kind of takes care of most of that regressivity. And that's just one of our tax bases. Obviously, we have income taxes as well, too, like in the U.S.
Mm-hmm. And totally fair if you're like, I have no idea. You might not know. What is like the tax, if it's easy enough to say in like less than 2 minutes, what is the tax scheme, if you will, in Canada, like income tax scheme? And or other tax,
So similar to the U.S., right? The different provinces, like the different states, have different tax systems, and there's good and bad things about the way that they're done. What I can say in 2 minutes is that as an American, I still have to do U.S. taxes, and what I end up owing, when you sort of calculate the U.S. taxes, and I have to calculate the Canadian ones, and that's a whole mess in and of itself. But it allows me to say that the taxes that I would pay in the U.S. Are not so different from the taxes that I end up paying here, right? So like, I'm not talking about down to the last, dollar kind of thing, but like generally the like kind of overall amounts are similar. It's not that like the taxes here are so much higher than
right. It's not like, I know that in some countries, notably in some Scandinavian countries, their income tax or their payroll taxes or whatever, however you want to couch it, are significantly higher than taxes in the United States. However, Medical care is included in that. College education, for the most part, is included in that. Even retirement, like a pension, is included in that. I mean, on and on. There's daycare, paid leave. I mean, there's so many things that are included for those taxes that you'd have to almost, to really compare, you'd have to then add the cost of all those things if you paid for them out of your pocket in the United States. And once you did that, I think you would probably find that they're not so different, in the end.
Hey, Kimberly, can I just say what just one thing to that?
If you make it really quick.
Okay. Well, go ahead. Go ahead. Keep on looking at your question. What
costs are borne by patients? I think we already went over that. Are non-citizen immigrants covered? At least in France, it sounds like yes.
Yes, if you're a resident and you've lived here for 3 months, I believe, you're covered. So I was covered as soon as I arrived, essentially, a few months later.
And I lived in Stockholm for 10 months or something a long time ago. And I was covered living there. I had some medical stuff happen while I was there, and I never had to pay anything out of pocket for it at all. Canada are not non-citizens covered?
Yeah, similar here. So there's some residency requirements, and there's something about the first, 3 to 6 or something months when you get here. But as long as you're, legal to.
What about in Germany, Christian? Because I know that not just Germany. I'm not singling out Germany, but a lot of European countries have had, let's just call them issues with the influx of immigration in the last 10 years or so. Is that like a controversy about, and are immigrants covered by your public insurance?
So I'm not entirely sure how it works for, like, let's say you're in asylum status, then you would probably also have some coverage from the state, which I would guess it's again similar, but I'm not really an expert on this. Otherwise, if you move to the country, if you relocate to Germany, you're also obliged to be either part of the public or the state-run system, and again, you contribute depending on your income, and but you cannot not have health insurance.
Okay. Somebody asked how the systems are rated in polls. We don't have polls. What did you not, what did we not ask? Somebody here said they're going to school to become a physician's assistant, which, for those, maybe you all know, it's kind of like a doctor, not exactly, but it's similar. They can do similar things here. I shouldn't say kind of like, it's like a doctor. I think they make less money and maybe require a few years less training. I'm sorry if somebody's a physician's assistant and I'm wrong. This person says, I think one of the best things that would come from universal healthcare is the ability of providers to dictate the course of their patients' treatment rather than leaving those decisions to an insurance company. Yes, we could not agree more. That's what we already talked about. So they said they'd like to know more about it from a provider's viewpoint. None of us here on this panel today are providers. However, I would point you to a website called Fix It Healthcare, FIXIT Healthcare, Fix It Healthcare. And there's a documentary film there that's about 58 minutes long that was produced by a Pennsylvania businessman, and he produced it basically to make the argument for universal single-payer healthcare system from a businessman's point of view, as I mentioned earlier, but also from a humanitarian view. And the reason I'm referring you to Fix It Healthcare to watch that film free online is because there's an American doctor interviewed in that film who moved to Canada because she was tired of dealing with insurance companies declining treatment that she wanted to provide her patients, or declining that prescription, or saying you couldn't get that prescription, or they weren't going to pay for that. So they interview her, and they show in her office billing. And the average American doctor, by the way, spends about $84,000 per doctor on just interfacing with insurance companies per year. And they showed billing, and the billing, literally they put a little time clock in the corner of the screen. It took like 13 seconds for her billing clerk to bill for a person's visit. They literally went click, 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 and the bill was submitted to the government for payment. I think we already covered how you're financially impacted by the version of healthcare you're living with. It sounds like the fabulous answer is they're not. Sounds like in France you're paying some out of pocket, but other countries you don't pay anything out of pocket. Like in Canada, you never do that. See also, I think on our campaign Facebook page, there's a
clip we pulled out from a debate on public television on Monday night, wherein I made my now becoming famous analogy where healthcare should be like a public library. So you don't pay for it, just like you don't pay for a library book when you go to the library. You just show them your card and you walk out. In the end, that's how healthcare should work. Yeah, that's how it should work. How do you guys view our healthcare system? I think we probably already went through that. Do you travel for healthcare? Are there specialists near you? I think we covered that. It depends on, just like here, it depends on whether you're in a more populated area or you're in a less populated area. Oh, we are getting to the end. Oh, good. Tim from my staff said he's culled the questions and the rest are duplicates. And the last couple questions are, last question is, how are women's reproductive rights affected? And I'm assuming they're talking about access to abortion. I'm guessing for the most part. I mean, that all they said is how are women's reproductive rights affected? So
I can say, I mean, for example, we have pretty broad coverage up front. So things like, I think IUD insertion is covered. Obviously going to the doctor to get prescriptions for birth control is covered. And then abortion is also covered, both, I don't know exactly all the details of it, but, that debate I would say is also maybe a little bit more settled in Canada than what's going on in the US. But, it's part of the public healthcare system. So it's provided. But I think that the part about all the upfront, birth control and making sure that people have access to doctors and that they're not facing a cost barrier, goes a long way to making a difference.
Cool.
I might just say something about women's healthcare in general in France. There are a lot of things that are covered, notably, like I mentioned, I have a young daughter, and so all of your prenatal care is covered. Your appointments with midwives prior to the birth. They even, I don't know how we say it in English. Let's see, rehab for your perineum, would that be right? Rééducation du périnée in French. That after you have free consultations afterwards, and something that's extremely expensive in the United States, which is infertility. Here in France, you can have up to 4 IVFs covered by the state, and I think something like 5 to 7 IUIs.
Wow.
Which I know.
I think there's some rare insurance that covers that in the US or part of it, but most people's insurance doesn't cover any of that.
Yeah, and I have had friends who have just been devastated by, it's already an emotional roller coaster for that kind of thing. And then when you throw in the fact that every IVF cycle, they're throwing thousands and thousands and thousands of dollars down the drain if it doesn't work. It adds on a whole other layer of stress. Whereas in France, infertility treatments are covered by the healthcare system as well.
Awesome. Cool. Well, anything that we didn't cover that you guys think is germane or that you just want to say, or I'm trying to think of more myths that people have recently, before COVID-19 hit big time, because it was at a campaign event. It was at, where I was talking to voters in person. So it must have been in like February or something. Yeah, a woman came up to me and said, well, that universal health care is a great idea, but, people are dying in Canada because they can't get treatment. I mean, the myths just, it is what it is. Oh, Tim.
Yeah.
So this is from my staffer, Tim. He said, I actually have a question. What is the biggest difference you've seen between living in the American healthcare system versus other systems?
I think for me, just to sum it up in a few words, is easy access, simple to know prior to receiving care how much it costs, how much is covered. easy access to medication. Like I mentioned just at the outset, it's just become in my life a non-issue. So it's because it's so accessible and comprehensive. There's no spot in my mind that's really reserved for it. It's just, I guess you could call that, I take it for granted, which being an American, I don't take it for granted because I have been subject to another system. But I do think that I would definitely advocate for a system such as this, having had the opportunity in my life to compare two different systems.
I just thought of one comment and one question myself, and I think somebody asked earlier, maybe I missed it. Two things. Comment is that we have an epidemic of 26-year-olds in the United States dying from rationing insulin because insulin is very, very expensive here, and they turn 26 years old. They're no longer allowed to be on their parents' medical insurance plan. So a lot of type 1 diabetics, young people are dying because they start rationing their insulin because they can't afford it. And I talk about this almost every single time I talk about healthcare because that is just absolutely unconscionable to me that is happening. We let pharmaceutical companies buy politicians in this country, and that's how that's allowed to happen. And the other thing now I'm trying to think of the other thing I was going to say. Doctors and nurses, I guess, for that matter as well, although nurses are typically, across the board paid far, 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 far less than physicians are paid. And I think that holds true in every country as far as I know. But do any of you know any doctors or have any way of knowing, like, vaguely what doctors and nurses make in your country? And do you know vaguely what doctors, I'm just curious, and I know this is probably all Googleable, but, some people, in other words, have a concern that we're not going to get anyone to become a doctor or a nurse anymore if we go to a universal single-payer healthcare system and they don't get paid enough. Because one of the reasons, sure, doctors and nurses want to help people, but they also know that in the United States, not all doctors that go into like public health or work at a clinic for people in poverty obviously are going to be at a different level. But the average doctor in the United States makes well over $100,000 a year, probably more like $250,000, $300,000 a year. And that's average. A lot of specialists make $500,000 upwards of that per year. So what is that? I mean, I'm kind of sort of especially interested in Canada. Like I have no idea like what an average family practitioner makes in Canada. No clue.
Yeah, I should know the numbers. I mean, that's a debate. I mean, we're having our own debate right now within Alberta in particular around kind of public spending and things like that. That's not even so much related to healthcare specifically and more sort of a lot of other things we have going on here. I certainly know, family doctors. I think, they are well paid. They're not, especially family doctors, they're not fantastically wealthy for sure. But I haven't really heard much in terms of people wanting to, preferring to go to the US because of the pay for doctors. I think some of the challenges here, like we were talking about before, getting doctors into more rural areas, those kinds of things, can be a challenge. But I think especially in the cities, we have a really excellent and kind of growing healthcare system. It's been great to see. We have a children's hospital in the city that I live in, which I had never, I grew up in a smaller town. That wasn't something that I knew. So the doctors that I know, I don't hear them talking about, we should be, we need to be making more. I don't think that's not a major concern.
Not a big thing. Okay, good. Well, I think that's all. Anybody else have any wrapping up comments? And then we'll wrap it up. No?
I was just going to say, I'll just say one thing that I think it's been, I understand that you're a political candidate. And what is fascinating to me is that this is
political at all?
Yes.
This should not be a partisan issue.
Well, I was going to say, I mean, I don't, that's my point, actually. My sense is that, for most of my life, this doesn't have to do with politics, that this isn't right or the left. So I have to say the fact that I've seen, my sense in this country, in America, that this is portrayed as that you're far to the left if you hold this view, or if you think universal healthcare. And that for me is just crazy. And so that's my final thing, I guess. That this doesn't feel like it should be on the political spectrum to me.
It shouldn't. It's a matter of, like I've said over and over, it's a matter of, do we think, and some people may, and I know do disagree in the United States that healthcare should be a fundamental human right. But I think that it should be in a moral and wealthy nation. And, so then from there, then we just have to figure out how we do it. But, seriously, it's horrible to have to say, but really the infiltration of corporate money, and most of that money coming from pharmaceutical companies and healthcare industry, which make billions of profits in the United States every year, that is why we don't have a better healthcare system. That is why. Because it becomes politicized, because there is so much money/power tied up in it. And it never should have been allowed to get this way, but it is. And here we are. It's $1 billion industry, billions of dollars in profits are made on the backs of sick people in this country. And so that's why it's become political, and that's why it's so difficult to undo it. And it all these puzzle pieces go together. Like, we don't have, this is a whole other show that we don't have time to get into, but be a good show to have, how other countries fund political candidates. Where do political candidates in Germany, in the UK, in Canada, in France, where do they get their money to run for office? Because I've raised about $250,000 over the past year, and ours is a very low budget U.S. Senate race. Very low. Most U.S. Senate candidates raise millions. So that's the kind of money we're talking about, because it costs hundreds of thousands just to be on TV. And if you can't be on TV, then enough voters can't know about you to vote for you. So we have this whole system, and we don't have any public funding of elections. So then corporations step in and are paying, giving all this money to candidates. And then, of course, those candidates feel like they owe those donors something. And then that's how we get where we are. So that's another project for another day. I would love to know more in depth how other developed nations, particularly Canada, just because it's so, it's so close. And yeah. Did you see the commercial a couple years ago about Canadians building a wall?
I think somebody sent that to me.
After the 2016 election, there was this commercial that went around like on YouTube and stuff, this little like funny thing about this Canadian guy in a plaid shirt, and you kind of can't figure out what he's doing at first. And then they pull back and you can see that he's building a wall to keep Americans out, because we're all concerned about the direction our country was taking. And, in regards to healthcare, I think that's not far from the truth. I think most Americans would much rather have that Canadian system. And hopefully over time, we will stop electing people who don't want to move to that. And so over time it will happen, but it's going to be difficult. Frederick Douglass, abolitionist, said, power never cedes anything without a demand. It never has, and it never will. And he said that in regards to getting rid of slavery, but you can be said in regards to anything like the huge influence of power and money in American politics. So it's not going to be an easy fix, but hopefully we'll get there someday. Anyway, thank you all so much for being here. Thanks, Christian, Vanessa, Sarah, Natalie. And
thank you very much.
Thanks.
Thank you for staying up so late, Natalie and Christian.
Oh, thank you. No problem.
And take good care and stay safe. And maybe someday on the other side of everything, I can see some of you in person.
Yeah.
Take
Bye.
Bye-bye.
Bye.
Bye.
I support Kimberly Graham because she's the only candidate in the field that's truly committed to fighting for all of us, not just the special interests.
I first heard about Kimberly because of the brand new Congress endorsement.
By not taking corporate PAC or lobby money, she's showing that she will only be accountable to us.
And we can really use a progressive voice from Iowa in the Senate.
She supports things like the Green New Deal and the Clean Air and Water Act and doesn't take any money from lobbyists. Please join me in voting for my future by voting for Kimberly by mail.